If you're someone who suffers from asthma or other respiratory conditions, chances are you're familiar with albuterol. This versatile medication has been a lifesaver for millions of people around the world, providing fast and effective relief from symptoms like wheezing, coughing, and shortness of breath. But what exactly is albuterol, and how does it work? In this comprehensive guide, we'll take a deep dive into this popular medication, exploring its uses, benefits, and potential side effects. Whether you're a seasoned albuterol user or just starting to explore your treatment options, this guide will provide you with all the information you need to make informed decisions about your health. So sit back, relax, and get ready to discover the ultimate guide to albuterol. How is albuterol administered? Albuterol can be administered in a variety of ways, including inhalation through a metered dose inhaler, MDI, nebulization, and oral tablets. Inhalation through a metered dose inhaler is the most common method of delivery. It involves using an inhaler device that delivers a precise amount of medication to the lungs with each dose. The medication is inhaled through the mouth, and patients are typically instructed to hold their breath for several seconds after inhaling to ensure the medication reaches the lungs. Nebulization is another method of delivery, especially for young children and elderly patients. It involves using a nebulizer machine to convert the medication into a fine mist that can be inhaled through a mouthpiece or mask. Oral tablets are also available, but they are less commonly used due to slower onset times and increased risk of side effects. How much albuterol to nebulize in adult? The recommended dose of albuterol for nebulization in adults is 2.5 to 5 milligrams every 4 to 6 hours as needed. However, the exact dosage may vary depending on the severity of the patient's condition and the individual's response to the medication. It's important to follow your healthcare provider's instructions carefully when using albuterol and to never exceed the recommended dosage. Overuse of albuterol can lead to potentially serious side effects, including tremors, palpitations, and chest pain. What is the difference between salbutamol and Ventolin? Salbutamol and Ventolin are both brand names for albuterol, so there is no difference between the medications themselves. Salbutamol is the generic name for albuterol and is commonly used outside of the United States. Ventolin is a brand name for albuterol that is marketed in the United States. Both medications are bronchodilators and work by relaxing the muscles in the airways, making it easier to breathe. What component does albuterol have? Albuterol is a beta-2 agonist medication that works by stimulating the beta-2 receptors in the lungs. This stimulation causes the muscles in the airways to relax, which allows for easier breathing. Albuterol also has a mild anti-inflammatory effect, which can help to reduce swelling in the airways and improve breathing function. Albuterol is a relatively short-acting medication, with effects lasting approximately 4 to 6 hours depending on the individual. How long does albuterol last? The effects of albuterol typically last for 4 to 6 hours, depending on the individual's response to the medication. It's important to remember that albuterol is a short-acting medication and is not intended for long-term use. If you find that you need to use albuterol more frequently than recommended, it may be a sign that your respiratory condition is not adequately controlled and that you should speak with your healthcare provider about alternative treatment options. What is the best bronchodilator? The best bronchodilator for an individual depends on their specific respiratory condition and their response to different medications. Albuterol is a commonly used bronchodilator that is effective for many people, but it may not be the best option for everyone. Other bronchodilators, such as ipratropium, tiotropium, and formoterol, may be more effective for some individuals. Your healthcare provider can help you determine the best bronchodilator for your individual needs. What side effects does albuterol have? Like all medications, albuterol can cause side effects, although not everyone will experience them. Common side effects of albuterol include tremors, nervousness, headache, and increased heart rate. Less common but more serious side effects may include chest pain, palpitations, and difficulty breathing. If you experience any of these symptoms after using albuterol, it's important to seek medical attention immediately. What if I give him salbutamol and I don't have asthma? Salbutamol is a medication that is used to treat respiratory conditions such as asthma and chronic obstructive pulmonary disease, COPD. If you do not have a respiratory condition, there is no reason to use salbutamol or any other bronchodilator medication. Using these medications unnecessarily can lead to potentially serious side effects and should be avoided. What does albuterol do? Albuterol is a bronchodilator medication that is used to treat respiratory conditions such as asthma and COPD. It works by relaxing the muscles in the airways, making it easier to breathe. Albuterol also has a mild anti-inflammatory effect, which can help to reduce swelling in the airways and improve breathing function. Albuterol is a relatively short-acting medication, with effects lasting approximately 4 to 6 hours depending on the individual. What do you put in the nebulizer for phlegm? If you have excessive phlegm or mucus in your airways, your healthcare provider may recommend using a nebulizer with a medication such as albuterol or ipratropium. These medications can help to break up the phlegm and make it easier to cough up. In some cases, your healthcare provider may also recommend using a saline solution in the nebulizer to help loosen the phlegm and improve breathing function. What to put in the cough nebulizer? If you have a persistent cough, your healthcare provider may recommend using a nebulizer with a medication such as albuterol or ipratropium. These medications can help to reduce inflammation in the airways and improve breathing function, which can help to decrease coughing. In some cases, your healthcare provider may also recommend using a saline solution in the nebulizer to help loosen mucus and improve coughing function. What is the generic of albuterol? The generic name for albuterol is salbutamol. Salbutamol is commonly used outside of the United States and is available in a variety of forms, including inhalers, nebulizers, and oral tablets. In the United States, albuterol is sold under a variety of brand names, including Ventolin, ProAir, and Proventil. While the brand names may differ, the medication itself is the same regardless of the name under which it is sold. Conclusion: albuterol is a versatile medication that has helped millions of people around the world to manage their respiratory conditions. Whether you use albuterol through an inhaler, nebulizer, or oral tablet, it's important to follow your healthcare provider's instructions carefully and to never exceed the recommended dosage. With proper use and monitoring, albuterol can be a safe and effective tool for managing respiratory conditions and improving breathing function. Thanks for watching.